Hello, everyone. I'd like to welcome you to Stony Brook Medicine's Healthy Libraries program. Today, we will be presenting primary prevention and breast cancer webinar for today. Next slide. So we want to tell you a little bit about the Healthy Libraries program. Stony Brook Medicine's Healthy Libraries program, and our acronym is HELP, is a partnership with the Public Libraries of Suffolk County, the Suffolk Cooperative Library System Outreach Services Department, and is supported in part by the American Heart Association of Long Island. This program is an interdisciplinary team of public health, nursing, and social work students whose aim is to provide evidence-based health information, screening, and case management to a diverse community of patrons in the public library setting. It also, one of the other aims is also to refer patrons to promote access to appropriate health and social services programs locally that will address their health and social support needs. And the last aim is for the students to experience an interprofessional team and demonstrate the core competencies which are based on the interprofessional educational collaborative. Next slide. So our student leaders, we have a few. Gwyneth Mersep, Phyllis Massaro, who is here with us today, Winnie De Los Santos, and Christine Weber, who's also here with us today. Faculty and staff leaders is Dr. Ben Scott, Professor and Director, Program in Public Health. Myself, Dr. Mary Ellen LaSala, Chair of the Undergraduate Department, School of Nursing. Dr. Denise Snow, Clinical Professor, School of Nursing. Leah Topak Walker, Social Worker, Field Educator, Coordinator, School of Medicine, School of Social Welfare. Jessica Cruz, who is our librarian, Health Science Librarian, School of Medicine, Program in Public Health, Biomedical Informatics. And last but not least, Gabriella Pandafello, who's our graduate student and Master of Public Health. Next slide. And I would like our students, our nursing students that will be presenting today, to introduce themselves. Alexia, can you go first?
Hi everyone, my name is Alexia Langell. I'm a nursing student pursuing a Bachelor of Science in Nursing at Stony Brook University.
Thank you, Alexa. Okay.
Hi, I'm Shine. I'm also a nursing student. This is my second year. I will be finishing by spring.
Great. Thank you, nursing students. And I'm Dr. Mary Ellen LaSala, Clinical Assistant Professor, and I'm Chair of the Undergraduate Studies. And nice to meet everyone. So our learning objectives for today are: at the end of this presentation, the participants will be able to identify different types of tumors related to breast cancer, identify how breast cancer may spread, identify modifiable and non-modifiable risk factors related to breast cancer, identify how often to perform self-breast examinations, identify signs and symptoms of breast cancer, and identify and define what a lumpectomy is. Thank you. Next slide. So please put yourself on mute. If you would like to ask a question, please enter the question into the chat box below. We will work to answer your questions by the end of the presentation. Thank you. Next slide. Okay. Alexia.
All right, so we just want to kick off the presentation by making it aware that October is our National Breast Cancer Awareness Month. Next. So some statistics on breast cancer. So breast cancer is the most common cancer in American women besides skin cancers. There are over 3.5 million breast cancer survivors in the US alone. 13% of women are at risk of being diagnosed with breast cancer at some point in their life, with a 1 in 8 chance of developing breast cancer. However, there's a 7 in 8 chance of remaining free of this disease. So in recent years, it has been shown that there's a slight increase of 0.3% each year in incident rates, and it is the second leading cause of death in women after lung cancer, with a 1 in 38 chance of death from breast cancer. So what is breast cancer? So breast cancer is defined as a disease that begins when cells in the breast tissue of both women and men grow out of control, forming a tumor that is usually visible on an X-ray or felt as a lump. Breast cancer occurs when malignant tumors develop in the breast. Breast cancer can start at different parts of the breast, one being the ducts that carry milk to the nipple in women, glands that make breast milk in women, aka lobules, and fatty tissue. So there's two different types of tumors, one being benign tumors. This is a non-cancerous mass of abnormal tissue. These tumors may continue to grow and eventually push on other organs, causing pain or other difficulties. This would cause doctors to intervene and remove the tumor that would otherwise have been left alone. Malignant tumors, on the other hand, are cancerous masses of abnormal tissue growth. These tumors are aggressive and they invade and damage the surrounding tissue. Doctors will perform a biopsy to determine the severity of the tumor, identified as either grade 1, 2, or 3. Grade 1 is considered low grade and well differentiated, meaning it appears as normal tissue and grows slowly. Grade 2, an intermediate grade, is moderately differentiated. And grade 3 is a high grade, poorly differentiated, meaning it appears abnormal. So how does cancer spread? So damaged cells replicate, leading to more damaged cells and tumor growth. Hormones and chemicals can accelerate the growth of some tumors, and lymph and blood vessels can carry the cancer to other areas of the body. Most of the lymph vessels of the breast drain into either lymph nodes beneath the arm or axillary nodes, lymph nodes near the collarbone or supraclavicular, meaning above, and infraclavicular, meaning below lymph nodes. Lymph nodes within the chest near the breastbone, or internal mammary lymph nodes. And myths debunked. So breast cancer is not contagious, nor is it caused by any of the following: cell phones, microwaves, antiperspirants, deodorant, plastic cutlery, mammograms, underwire bras, or caffeine.
Types of breast cancers. So the process of staging determines the amount of cancer in the body, including it has spread and if so, how far. Stage 0 means carcinoma in situ, very early cancer. Carcinoma means cancer in situ means it's in its original place. So there are two types of stage 0 breast cancer. One is ductal carcinoma in situ, and the other one is lobular carcinoma in situ, and they are non-invasive. Stage 1, evident cancer but still in its original place. So stage 1A, tumor is less than 2 centimeters in size and has not spread to the lymph nodes. Stage 1B, lymph nodes have evidence of cancer in clusters between 0.2 millimeter or to 2.0 millimeter in size, and neither no tumor or a tumor less than 2 centimeters in size. Stage 2, the cancer is growing but still in its original place or only spread to the nearby lymph nodes. Stage 2A is invasive. It could be no tumor and cancer has spread to the lymph nodes, or tumor less than 2 centimeters, cancer has spread to the lymph nodes, or tumor greater than 2, from 2 to 5 centimeters, cancer has not spread to the lymph nodes. Stage 2B is also invasive. The tumor could be 2 to 5 centimeters and cancer has spread to the lymph nodes, or the tumor is larger than 5 centimeters, but it has not spread to lymph nodes. Next. Stage 3, the cancer has extended into nearby lymph nodes and muscles, but has not yet to distant organs. For stage 3A, the tumor is less than 2 centimeters. Cancer has spread to 4 to 9 lymph nodes, or tumor could be larger than 5 centimeters, and cancer has clusters found in the lymph nodes. Tumor could be larger than 5 centimeters and has spread to lymph nodes near the breastbone or underarm. Stage 3B, lymph can be any size. Cancer has spread to the chest wall or breast skin, and cancer has spread to the lymph nodes. Stage 3C, It could be no tumor or a tumor of any size, and cancer spread to 10 or more lymph nodes. Or it could be no tumor or a tumor of any size, cancer spread to lymph nodes near collarbone. Or it could be no tumor or a tumor of any size, and cancer is spread to lymph nodes near the underarm or breastbone. Next. Stage 4. Cancer spread to other areas of the body, including the bones, brain, lungs, and liver. This stage of cancer cannot be cured, but can be treated to manage the disease and maintain the individual's quality of life.
So now we're going to get into the different types of breast cancer specifically. So ductal carcinoma in situ, or DCIS, is an abnormal cell growth in the milk ducts of the breast. This is an early form of cancer and the most common non-invasive type. It is a low-risk breast cancer, and a common treatment is lobectomy or surgical removal of the lump. So now we have invasive ductal carcinoma, or IDC. So this is an abnormal cell growth invading surrounding breast tissue outside of the milk duct. This is the most common type of invasive breast cancer, and the first sign of IDC is a lump that you can either feel or an abnormal mass on a mammogram. Lobular carcinoma in situ, or LCIS, is an uncommon abnormal cell growth limited to the lobules or milk gland of the breast. LCIS is not a cancer, but it indicates high risk of breast cancer and requires frequent screenings to reduce the risk. An invasive lobular cancer, or ILC, is an invasive breast cancer that starts in the lobules and spreads out to other breast tissues. This is harder to detect upon physical examination or in a mammogram, but an MRI can be used to study the extent of the cancer.
Triple-negative breast cancer. Triple-negative breast cancer is a type of breast cancer that is not caused by hormones like estrogen, progesterone, or HER2 protein. So hormonal therapy will not be effective for them, but chemotherapy is an effective treatment. Inflammatory breast cancer. Inflammatory breast cancer is an aggressive cancer that is fast-growing and blocks lymph vessels by cancer cells from the breast. Breast may appear to be red, swollen, and warm, and it could also have this dimpling texture. It's like an orange peel skin texture over the breast. It might appear like mastitis, which is an infection of the breast, occur often in breastfeeding women, but mastitis can be cured by antibiotics in about a week. Metastatic breast cancer is diagnosed when cancer cells of a malignant tumor have spread to other parts of the body, usually through the lymph system, and form a secondary tumor. It is classified as stage 4 breast cancer. Breast cancer cells break away from the breast and travel to other parts of the body, commonly in the liver, brain, bone, and lungs. Metastatic disease is not hopeless, and many people continue to live long lives with it. And there are other types of breast cancer that's less common. They are, you might have heard of them. They are called medullary carcinoma, tubular carcinoma, mucinous carcinoma, which is also called colloid carcinoma, and Paget disease of the breast or nipple.
So now we're going to get into the risk factors of breast cancer. So non-modifiable risk factors, or things that cannot be changed, include age. Individuals are more susceptible to develop breast cancer at 55 years or older. The family or one's own history of breast cancer, especially with the BRCA2 gene. Age of menarche before 12 years or menopause after 55 years old. Race, white women are more susceptible. Radiation exposure from previous therapies. And gender, women are more likely to be diagnosed with breast cancer than men. There are also modifiable risk factors, things that can be changed. So this includes alcohol ingestion, being overweight or obese after menopause due to the increased estrogen levels, lack of physical activity, not having children or having children late in life, over 30 years old, birth control or hormone therapy after menopause, not breastfeeding, and breast implants. And now we can talk about some ways of early detection. So the first is self-examination. So a breast self-examination should be done once a month and typically 2 to 3 days after your period. You want to examine the breast and armpit with your arm raised. You want to use your finger pads with massage oil or shower gel, and you want to go up and down, circular motions. And then you want to look while laying down and in the mirror. And Jiaying will go further into self-examination.
So in the shower, like as pictured, you're gonna raise your arm and with the pads of your 3 fingers, put light to medium pressure on your breast and armpit area. Check monthly and look for lumps, thickening, pain, or any other abnormal changes. In front of a mirror, visually examine your breast with your arms by your side. Look for unusual size, color, or shape changes such as redness, swelling, or soreness. Look for peeling or an uneven texture on the skin. Nipple changes, inverted nipples, or a rash around the nipple. And raise your arm and look for the same changes. Lying down. So examine each breast lying down with your opposite hand as pictured. Move the pads of your fingers around your entire breast to feel for lumps, discharges, and other abnormalities. Routine visits. So annual physical exams with your primary care provider, annual gynecology visits. Women over 40 years old are recommended to begin annual mammograms. Be familiar with how your breasts will normally look and feel, and report changes to your provider right away. Some of the diagnostic testing that you may have to examine for breast cancer. So first one is breast exams. Health providers will check both breasts and feel for any lumps and abnormalities, or you can do self-examination. Mammogram, it's an X-ray of the breast to detect breast cancer early, or breast ultrasound. It uses sound waves to create detailed pictures of areas inside the breast. Breast magnetic resonance imaging, or MRI, it uses magnetic and radio waves to create an imaging of your breast tissue, but this is only used for high-risk individuals. Biopsy. When there's a confirmed solid mass, a biopsy could be ordered to remove cells from the suspicious area and either to confirm or refute the presence of cancer. So this is a picture of mammogram. It is frequently used to detect breast cancer early. So you can see one of the breast is put on top of the plate, and the top plate will press down to take an X-ray. And in the picture on the right, these are little dots, bright little dots, and it's indicative of cancer. Next. And signs of symptoms that you should look out for that could be early signs for breast cancer. A change in the way one's nipple and or breast feels, tenderness, lumps, thickening, texture. A change in the way one's nipple or breast looks, size or shape changes, dimpling, swelling or shrinkage, inverted nipple or recent asymmetry, and nipple discharge, particularly clear or bloody, if not breastfeeding, milky. Skin around the breast, nipple, or areola becomes red, scaly, or swollen, or may show ridges or peeling like the skin of an orange.
And now we will talk about treatment options. So the importance of having a care team. So some providers would include medical oncologist, radiation oncologist, surgical oncologist, a care manager or a caseworker, and a dietitian. So some questions to ask your healthcare provider upon diagnosis. What are my treatment options? Which treatment do you recommend? How soon do I need to begin treatment, and how long will treatment last? What risks or side effects are there to the suggested treatments? How will treatment affect my daily activities? What are the chances of the cancer coming back after treatment? And what would we do if the treatment did not work or if the cancer did come back? So to start with systemic treatments. So systemic treatments include radiation therapy, which uses high energy rays to kill cancer cells, only affecting cells in that part of the body. And this is typically used following surgery. There's also hormone therapy, using medications such as blockers and inhibitors to cut off the cancer cell's supply of hormones. This is also typically used following surgery, and the most used drug is tamoxifen. There's also targeted therapy, using drugs to block the growth of breast cancer cells, and this is commonly used in combination with chemotherapy. And then finally, chemotherapy, which I will go further into on the next slide. So chemotherapy is systemic therapy using a combination of cytotoxic drugs to travel in the bloodstream throughout the entire body and either destroy cancer cells or slow the growth of cancer cells. Chemotherapy can be given before surgery to shrink the tumor prior to the surgery for easier removal, or after the surgery to kill any cells left behind or that have spread but may not be seen in the imaging. So possible side effects of chemotherapy include hair loss, loss of appetite or weight loss, nausea and vomiting, increased risk for infection and bruising, mouth sores, numbness and tingling in hands or feet, birth defects if in the first trimester of pregnancy, and infertility. So these are some surgical options. So lumpectomy is breast conserving surgery. Only the tumor growth part is removed to preserve maximum amount of breast tissue. Then we have mastectomy, which is eliminating the growth of breast cancer cells by surgically removing all breast tissue in the breast. So a high-risk individual has the option of preventive mastectomy, which would involve removing both breasts before the onset of disease to reduce the risk of developing breast cancer in the future. Reconstructive surgery. So breast reconstruction is rebuilding a new breast shape or artificial breast using surgery for women after the removal of a whole breast or part of the breast. Breast reconstruction can be done at the same time of the mastectomy or in the future. Reconstructed breasts may not feel or look the same as a natural breast, and recovery is longer. Breast reconstruction will not increase the chance of recurrent breast cancer.
Prevention, lifestyle changes. So some of the healthy habits to reduce your risk including maintain a healthy weight, physical activity. Center of Disease Control recommends 150 minutes of moderate activity a week, such as walking and 2 days of muscle strengthening activity. Do not smoke. Healthy diets, so eat a lot of fruits and vegetables. Limited alcohol intake or complete abstinence. And encourage breastfeeding. The longer you breastfeed in your lifetime, the more risk reduced.
Hello. Do you have okay, ID? All right, sure.
Resources. We're gonna talk, yeah. So genetic counseling. A genetic counselor is someone who discusses any cancer history in your family that may put you at higher risk of getting breast cancer. You can have the discussion about if a genetic test is right for you, the risks and benefit of genetic test results, additional tests that may be needed for a conclusive result, giving advice or a referral if you have a positive or negative result, the effect of a genetic test result that may affect your family members. BRCA. BRCA stands for breast cancer gene. There are BRCA1 and BRCA2 genes. They are human genes which produce tumor suppressor proteins that regulate normal cell growth and repair DNA mutations to help prevent breast cancer. When BRCA1 and BRCA2 genes don't work properly or are mutated, cells may grow out of control and damaged DNA may not be fixed, which can lead to cancer growth in the breast. Harmful BRCA1 and BRCA2 gene mutations can be inherited from one's mother or father and increase their risk of getting breast cancer. Genetic testing is available to detect harmful BRCA1 and BRCA2 gene mutations.
So some emotional support. So support groups and programs. So the cancer support community hosts meetings in various cities around the country as well as online. There's also a mobile app called Instapeer. American Cancer Society's Reach to Recovery program, which provides one-on-one support between those newly diagnosed and survivors. American Cancer Society's Cancer Survivors Network, which offers discussion boards and chat rooms. NBCF, or National Breast Cancer Foundation, hosts monthly support meetings virtually. And there's also griefshare.org, which is a website for those who have experienced loss of a loved one. So ongoing breast cancer research. So what's new in the research? So they are continuing to study the best use of genetic testing and the effects of exercise, diet, and weight changes on risk. So they ask, could gene variations increase the risk rather than solely genetic mutations? An active area of research would be environmental influences. They're looking for non-hormonal medications that may help prevent or treat breast cancer. They're looking at the use of liquid biopsies, which test for circulating tumor cells, or CTCs, and circulating tumor DNA, or ctDNA. They're also looking at new imaging tests, such as molecular breast imaging or positron emission mammography, PEM. So these are some national helpline resources as well. For example, the National Domestic Violence Hotline. These are more local helpline resources, which would include APS, or Adult Protective Services. And these are some additional resources for our program, the HELP program specifically. So we have our YouTube, our Facebook page, our website, an email address, and a phone number.
Any questions from our participants? Okay, Gabriella, do you have anything you want to say to wrap up?
No, I guess just before we go, just want to make sure if there's no questions before we end the presentation. The recording of the program as well as the slide deck will be available on our YouTube page and will eventually be uploaded to our Facebook page. So if you want this information to refer back to, you can find that there. Also feel free to email us or contact us if you just go back to our help information slide.
Great. And Dr. Snow?
Oh, it seems like someone...
I have a question. At what age would you... Whoop, I just lost it.
At what age would you recommend teens to begin gynecology appointments?
Oh. Why am I?
No.
What's the question?
At what age would you recommend teens to begin gynecology appointments?
Well, it depends on their needs. I think you're probably aware that the recommendations for pap smears, which is the main reason that most people start their gynecology appointments, has changed. We used to say 18, but it's now thought that the pap smear should start at age 21 or when the teen becomes sexually active. So, again, there's no hard and fast number. It's when somebody has a teen might have questions, they might have needs, or they may want to speak to a nurse practitioner, a nurse midwife, or a physician about their healthcare needs.
Great. Thank you, Dr. Snow, who's also a midwife and an attorney. Yes, thank you. Any other questions? And Dr. Snow, do you have anything you'd like to add?
I think that that this was an excellent presentation and was really jam-packed with a lot of information. I think it was really important that they brought up the fact that genetic testing is taking a bigger role in not only breast cancer, but many other types of conditions that we're finding that there can be, in addition to environmental factors, there can be genetic factors. So taken together, I'm hoping that instead of 1 out of 8, we'll have, none out of 8 in the future. So thank you again for this jam-packed informational webinar that you produced, Ms. Liu and Ms. Lango.
Thank you.
Excellent work. Okay. I guess if there's no other questions, we will conclude this wonderful webinar. Thank you all for attending.